Hello everyone and welcome to Peepul Health, an online forum that's going to bring you seminars, live workouts and nutritional guidance and advice on overall health and well-being at the Peepul Center. My name is Sumeet Sondaghar. I'm the head coach for the gym and spa department, and today we are going to talk about diabetes. What is diabetes? Diabetes, as we know, is the metabolic dysfunction of the hormone insulin, which elevates the blood sugar levels inside the bloodstream or the blood cells. We can categorize diabetes into two forms. We've got type 1 and type 2. In both cases, the level of glucose is always elevated. The difference is how. Diabetes is common amongst 1 in 15 of us, out of which 90% have type 2 and 10% have type 1. It can be caused by family history, age, obesity, or simply poor lifestyle choices. What is type 1 diabetes? With type 1, the hormone insulin is not produced at all because the pancreas has become dysfunctional. This causes the glucose to build up inside the bloodstream and it doesn't go into the cells. So you still get elevated levels of blood sugar levels. Some of the symptoms of type 1 diabetes is rapid weight loss, frequent urination, nausea, weakness, and some severe conditions can be ketoacidosis or kidney dysfunctions. Type 1 can be diagnosed and it can be treated simply by injecting insulin inside the body. But it's very important for all of us to understand the amount of insulin is important and paramount. We can also look after type 1 diabetes by also looking after our health and well-being and making lifestyle choices. Food is a very important factor when you have diabetes. With type 2, there's slightly different complications with type 2. It's the more trickier one. It's the more challenging one amongst the two. Because with type 2 diabetes, the insulin is either inadequate or is far too much, which causes a lot of glucose to be either built inside the bloodstream, or most commonly there's far too much glucose going into the cells. That can cause a lot of complications inside the body and a lot of symptoms. Obesity is one. Then we've got blindness of the eyes, which is another severe condition. We can have a lot of mood swings and other conditions which can also impact us when we have type 2 diabetes. With type 2 diabetes, it's a challenging and trickier one because we have to monitor sugar levels throughout the day due to the inadequate production of insulin. So therefore, we sometimes need to inject insulin in the body, or sometimes we need to cut down the sugar that we consume throughout the day. Diabetes type 2 can be managed very well with very healthy lifestyle choices, especially when it comes to nutrition. Exercise is very important, but nutrition is the key factor. Managing your calories throughout the day according to your body weight is really important. So with type 2 diabetes, we can still manage it, but it just becomes that little bit more challenging compared to type 1. In both conditions, though, we need to understand that the sugar levels are always rise. It's just that how that happens is different. If you've been living with diabetes or you've just been diagnosed with diabetes, then there are things that you can do on a daily basis to look after yourself. Just because you have diabetes doesn't necessarily mean you always need to go on medication. If you're someone with type 1 diabetes, then it's very important to measure your sugar levels. As well as it's important to measure your sugar levels with diabetes too, it just becomes a little bit more trickier. With type 1 diabetes, most commonly you will be injecting insulin. The amount of insulin is important. Generally, when you measure your sugar levels and your sugar levels are between 4 to 7 millimoles is around a healthy range. With type 2 diabetes, what happens is there's a lot of fluctuation because of the inadequate insulin production actually inside the body. So there'll be times when you'll be hypoglycemic and there'll be times when you'll be hyperglycemic. So this becomes a bit more challenging for people with type 2 diabetes. Although it is known that with type 1 diabetes, you will be injecting insulin throughout the day and going forward, but that doesn't mean that you can't look after your health. There are a lot of health choices that you need to, there are a lot of healthy choices or healthy lifestyle changes that you can make to manage type 1 diabetes. Simply looking after yourself 3 to 4 times a week, going to exercise in the gym, and doing some moderate activity will be good enough. Monitoring your sleep, monitoring your calories, and the choice of food is also will actually keep your health and well-being at a quality throughout the day. The management of type 2 diabetes can be a little bit tricky and challenging. There's a lot of help out there, but there's also a lot of knowledge and research that has come out that can be used on a daily basis to make better lifestyle choices. What's important to understand with type 2 diabetes is the sugar levels during the day and the fluctuations during the day. Some of the common strategies are to measure your sugar levels upon waking up, and then in the afternoon, and then before you sleep. However, new research has come out, and it's important to measure your sugar levels after activity as well, and the type of activity as well. So if you go for a walk, I would suggest you measure your sugar levels after a walk and see what levels they are and how it affects you. If you're doing intense exercise, where it's a lot of HIIT training or heavy weightlifting, or doing a very intense class, then check your sugar levels before and afterwards. This will give you an idea of the level of the fluctuations between your sugar levels throughout the day and in terms of with different activities that you undertake. You can also go as far as also checking your sugar levels after eating certain types of food. For example, check your sugar levels after having a banana, and then compare that to having maybe some dates or some watermelons or fruit, or simple as carbs such as rice, chapati, pasta. Check your sugar levels after eating food is important, because you'll gain more awareness of what's happening inside your body and how your body is responding to certain foods that you eat. Yes, it's important, and we commonly hear that, healthy foods such as fruits, vegetables, lean protein, water, good fats, eating clean is important. Eating clean is always going to be beneficial for you. But however, it's a myth. You don't always need to eat clean. If you do fancy having alcohol, if you do fancy having a takeaway, if you do want to enjoy yourself and indulge in some chocolate and cake, this is entirely okay, as long as you are aware and in control of the sugar levels. So with type 2, it can be quite challenging when it comes to managing type 2 on a daily basis. But if you look after your health and well-being and become more aware about yourself, because no size fits all, the more you look at diabetes 2 from a tunnel vision view for yourself, that will help you gain more awareness of what's happening inside your body and how your body is responding to the different variables that are responsible for the sugar levels. So yes, as a whole, we need to eat clean, eat healthy, and get adequate exercise and eat the right quantity of food, but you still need to look at it from an individual point of view. Most commonly with type 1 diabetes, the sugar levels can drop low. So therefore, it's important to have carbohydrates and food ready if that does happen. Sugar level, anything which is 250 mg or 300 plus, exercise has to be looked after. We recommend that you avoid exercises, but however, if you have been prescribed by the GP that you can exercise with those levels, then go ahead. But make sure you get advice from your GP before you exercise. Most commonly with type 1 diabetes, the sugar levels do drop. So therefore, you can monitor the sugar levels before and after exercise as well. If after exercise the sugar levels drop very low, then obviously you've got the carbohydrates ready there to eat, so you can raise the sugar levels again. Now that we've talked about diabetes as a whole and in general, and the different types of type 1 and type 2, and the role of insulin when it comes to diabetes, and the treatment and diagnosis and the medications, and also, what to be aware of if you do have either of the conditions, we're going to now go a bit more in depth with the nutrition, because this is a key part of diabetes. So in our next video, we're actually going to do a live video of we're going to talk about a live video of food actually in the kitchen, and we're going to go through and show you some examples of food choices that you can actually swap and change, some recipes that actually can be within the calorie deficit or calorie allowances according to your body weight. So thank you very much for watching the video, and we look forward to seeing you in the next one.